Desperate warnings from the front lines after a weekend that showed no signs of this third peak of the coronavirus pandemic slowing anytime soon in this country, with back-to-back numbers like we have never seen before. More than 75,000 cases on Thursday, Friday, and Saturday. Our new 7-day average is more than 68,000 new cases every single day, an all-time high, up more than 22% from just 1 week ago. And in just the last 24 hours, the U.S. has added more than 80,000 new cases, bringing our total to more than 8.7 million infections, with more than 226,000 American lives lost. Cases also continued to climb in Europe over the weekend. Yesterday, France added a record more than 52,000 new cases, just after becoming the second European country to surpass 1 million cases total, behind only Spain, which declared a state of emergency yesterday and announced an overnight curfew to help them contain the rising infection rate there. Joining our conversation, vaccine expert Dr. Peter Hotez, founding dean of the National School of Tropical Medicine at Baylor College. Dr. Hotez, as much as we love talking to you, I had really hoped that we would be on a different trajectory and that maybe we'd be looking at something associated with flu season. But this seems like a COVID spike wholly separate from the advent of flu season. And it's very scary to a lot of people. These are numbers that we didn't even see in our first spike in the spring.
Well, it is scary, Nicole, and it unfortunately it looks as though the worst is yet to come. We're now reaching our highest 7-day average ever in this epidemic, and with no end in sight. And the worry, of course, is we're going to get to Dr. Fauci's apocalyptic number of 100,000 new cases a day, and it looks like that's the direction that we're heading. And it's happening in a very interesting way. It's really starting up in the northern Midwest and then across the north, and it really is showing this interesting flyover nation pattern where Oregon, Washington State, California look okay, and New England, except for Rhode Island, looks okay. The Mid-Atlantic states look okay, and then the rest of the country on the heat map is starting to turn all red, mostly in the north in the beginning. So we're in for what looks like a horrible winter. And the tragedy, of course, is we could have not entirely prevented it, but we could have dramatically delayed it. I put forward an October 1 plan over the summer, sent it to the White House, no response, no activity. Potentially, we could have slowed this and drawn it out in a way that would have kept it at a minimum until vaccines became available next year to save lives. Right now, the Institute for Health Metrics is pointing to 511,000 deaths by February 28th, with possibilities that we could lower it with aggressive mask use. But again, there's no advocacy for that in the middle of the country. So I'm just devastated.
I am too. And I guess my question is, what does a response with just the people that believe we can take that grim fate of more than 500,000 dead Americans, dead grandparents, dead children, dead teachers, dead frontline workers? What can we do with just part of the country adhering to the health guidelines, wearing masks, social distancing, not gathering in large crowds?
Well, it's tough because we don't have any centralized leadership. We have no national response. So it's basically, it's always been all year, the states on their own. And with the federal government providing useful and important backup support for manufacturing of PPE and ventilators and supply chain management. But it was never enough. We needed the full force of the federal government. And, you know, you heard Mark Meadows over the weekend say there's no national plan, or at least that was my interpretation. Maybe you could go back to the original words. But it's basically business as usual, and essentially leaving it up to the states. And then many states, in turn, are leaving it up to the individuals to make their own decisions. So it's a scary scenario.
The original quote, it stuck in my brain, was, "We can't control a pandemic," or something along those lines. We can't. And Jake Tapper pushed back forcefully and said, why not try? He made clear that it isn't their strategy to contain the pandemic. Dr. Peter Hotez, given the news, we will be calling on you early and often. Thank you for your candor, my friend.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.